Good morning, everyone. How is everyone doing? Can I get a smile in the house? Very good. I got a couple of smiles. That's good. My name is Dr. Maya Rocky Moore Cummings. I am a visiting professor at the Johns Hopkins University Bloomberg School of Public Health, and it is my honor and privilege to serve as your mistress of ceremonies for today's events. I plan to keep everything moving so that we can, of course, keep time and certainly make sure that we hear from our fantastic speakers while we remain on purpose. I want to remind you that a free networking lunch will be available on the 8th floor immediately following the end of today's events. So please do join us upstairs after the keynote speech at noon. We will start this morning's event with a welcome from the leaders of the Hopkins Center for Health Disparities Solutions and the Hopkins Center for Gun Violence Solutions. First up, we will hear from Dr. Daryl Gaskin, the William C. and Nancy F. Richardson Professor at the Johns Hopkins Bloomberg School of Public Health and the Director of the Hopkins Center for Health Disparities Solutions. A health economist, Dr. Gaskin's research advances community, neighborhood, and market-level policies and programs that reduce health disparities. Immediately following Dr. Gaskin's remarks, we will hear from Dr. Cassandra Cass-Krifasi, an associate professor at the Bloomberg School of Public Health and the co-director of the Hopkins Center for Gun Violence Solutions. Dr. Krifasi's research focuses on evidence-based policies and programs that reduce violence and advance equity. Let's give a warm round of applause for Dr. Daryl Gaskin and Dr. Cass-Krifasi.
Thank you, Dr. Cummings, and good morning to every one of you. Thank you for joining us today to address a critical issue that profoundly impacts the health and well-being of our communities, that is gun violence. It is both an honor and a responsibility to host this event as we bring together diverse voices to discuss strategies for gun violence prevention, aiming to reduce health disparities and to achieve health equity. Gun violence is a public health crisis that disproportionately affects marginalized communities. The ripple effects of this violence extends beyond immediate trauma, affecting physical health, mental health, economic stability, and overall quality of life. As we seek to understand and address health disparities, we must recognize pervasive influence of gun violence on our efforts. The data are clear. Communities of color, particularly Black and brown communities, are more likely to experience gun violence. This is not merely a matter of individual behavior, but a consequence of systemic inequalities from poverty, limited economic opportunities for families, and the lack of access to quality education and health care. To truly move the needle on health equity, we must address these root causes and implement comprehensive strategies to prevent gun violence. Our discussion today centers on the intersection of gun violence and health disparities. A lot of the momentum around reducing gun violence is in response to mass shootings. However, other types of gun violence, homicides, and shootings resulting in injury that disproportionately impact Black and brown communities have to be addressed. The panelists we've gathered this morning will help us explore evidence-based interventions, policy solutions, and community-driven initiatives that can mitigate the impact of gun violence. By adopting a holistic approach, we can create environments where all individuals have the opportunity to thrive without the constant threat of violence. We are privileged today to have with us today a diverse panel of experts, practitioners, and advocates who will share their insights and experiences. Their perspectives are invaluable as we work together to develop strategies that are not only effective, but equitable and just. I want to emphasize the importance of collaboration in this endeavor. Addressing gun violence requires the concerted effort of public health professionals, policymakers, community leaders, and more importantly, the effective communities themselves. I always like to say that there's no solution for us without us. And so together, we can advocate for policies that promote safe neighborhoods, support mental health services, and ensure equitable access to resources. As we move forward, let us remain steadfast to our commitment to justice and equity. Let us continue to listen, learn, and act with urgency and compassion. The stakes are high, but the potential for positive change is even greater. By preventing gun violence, we take a significant step towards closing the gap in health disparities and achieving true health equity for all. I'd like to thank and acknowledge our partners in organizing this event, the Johns Hopkins Center for Gun Violence Solution, the Congressional Hispanic Caucus Institute, the Congressional Black Caucus Foundation, and NMAC. I also would like to thank the Johns Hopkins Nexus Award Program and the William C. and Nancy F. Richardson Professorship for their generous support of these Hope Challenge forums here at the Johns Hopkins University Bloomberg Center. Thank you, each and every one of you, for your dedication to this vital cause and for your participation today in today's event. Together, we can make a difference and create a safer, healthier future for our communities. Thank you again.
Thanks so much, and I'm honored to welcome you to today's event on behalf of my co-director, Josh Horowitz, and myself. At the Center for Gun Violence Solutions, we really understand the urgency of this pressing public health issue. We conduct rigorous research and apply an equity lens to all the work that we do, which is why I'm so excited that today's event will bring together researchers, practitioners, advocates, who will share their expertise on understanding this issue and potential solutions. For too long, violence in minoritized communities has been treated with only a criminal legal approach, rather than receiving the public health resources and solutions that this issue and these communities deserve. In 2022, which is the last year that we have complete data from CDC, more than 48,000 Americans died from gun violence. That's including homicide and suicide, among all of the other forms. That's more than 130 people dying every day from guns in this country, and many more non-fatal injuries. But we know that this violence is not experienced equally or distributed equally across the country. In just a decade, from 2013 to 2022, gun deaths among kids and teens in this country increased by 87%. Compared to white kids and teens, Hispanic kids and teens have a gun homicide rate 4 times higher, and our black kids and teens have a gun homicide rate 20 times higher than their white counterparts. And in 2022, for the first time ever, the rate of gun suicide among our black kids and teens surpassed that for their white counterparts. Gun violence is one of the most pressing public health issues of our time, and it's robbing us of our young people. So I'm so glad that we are going to have this conversation today to really try to understand how can we move forward solutions. But anyone who knows me will tell you that I'm a pessimistic person by nature. That tends to be my default, despite efforts to change that. But when it comes to reducing gun violence, I'm actually optimistic. I'm optimistic because we have policies and programs in communities across the US right now that are effective and are broadly supported by most Americans. We don't have to go create new policies or new programs, although we certainly want to be innovative. But there are places in the US that are putting these policies and programs into place that we can learn from. And I think it's appropriate that this last event of the Hope Challenge falls during Gun Violence Awareness Month. And I think Hope Challenge is really an apt name for today's discussion, because my perspective is the enemy of progress on this issue is not those who disagree, not even those who disagree most vehemently. The enemy of progress at reducing gun violence in this country is often indifference. There are far too many people who don't know enough about this issue, don't feel impacted enough, or have bought into the narrative that we don't know what to do to reduce gun violence, and so they do not act. I'm hopeful that today's event will help stem the tide of that indifference and motivate folks in our country and across communities to take the action that we so urgently deserve. So thank you so much for joining us today, and welcome to the conversation.
It is now time for our first panel to begin. As I read the bios of the panelists, I'd like for them to come to the stage. We are certainly pleased to have some of the foremost experts in the nation on this issue of gun violence at the intersection of health disparities. And one of them is Mr. Daniel Webster. He is the Bloomberg Professor of American Health at the Johns Hopkins Center for Gun Violence Solutions. He is the recipient of the Johns Hopkins Distinguished Alumni Award, and his research focuses on the prevention of gun violence, gun policy, gun acquisition, and carrying by underage youth and other prohibited persons. Intimate partner violence and youth violence prevention is also an area of expertise for him. He developed one of the first courses on violence prevention in a school of public health. And he was also the co-editor and contributor to the book, Reducing Gun Violence in America, Informing Policy, Evidence, and Analysis. It was published by Johns Hopkins University Press in 2013. Welcome, Daniel Webster. Next, we have Ms. Fatima Lauren Dreyer. She serves as the vice president of a Boston-based public health institute called HRIA, the inaugural executive director of the Kaiser Permanente Center for Gun Violence Research and Education, and the executive director of the Health Alliance for Violence Intervention. She served as a technical assistance lead for the White House Community Violence Intervention Collaborative and worked alongside coalition partners to secure billions of dollars for community violence intervention through the American Rescue Plan Act. Dreyer cites her family's experience with incarceration and homelessness as the fuel that drives her advocacy. Welcome, Fatima Lauren Dreyer. With more than 25 years of experience, Chief Pamela A. Smith, DC Police Chief Pamela A. Smith, started her law enforcement career as a patrol officer with the U.S. Park Police in 1998, and she rose through its ranks to become its chief of police. She was the first African-American female to serve as chief in the agency's 230-year-old history. In 2022, DC Mayor Muriel Bowser tapped Smith to become the Metropolitan Police Department's Chief Equity Officer, and she was promoted to Chief of Police in 2023. The recipient of numerous awards and recognitions, Chief Smith leverages her platform basically to focus on youth, certainly, and women in law enforcement, among other issues. Please join me in welcoming Chief Pamela A. Smith. And last but not least, we are joined by author, public speaker, entrepreneur, and award-winning journalist, Mr. Roland Martin. Roland has a unique voice that's unparalleled in contemporary journalism. As the host and managing editor of Roland Martin Unfiltered, Roland created the first daily online show in history focused on news and analysis of politics, entertainment, sports, and culture from an explicitly African-American perspective. In October of 2022, Martin was named a Fellow of the Society of Professional Journalists, the organization's highest honor. In December of 2021, he was inducted as the youngest living member of the National Association of Black Journalists Hall of Fame. In 2008, he was also inducted into the Texas A&M University Journalism Hall of Honor. Please welcome to the stage our moderator, Mr. Roland Martin.
Hey, how we doing? All right, I never sit down at these things, so glad to see everybody here. So, panel, how we doing? Great. All right, so we had a Zoom last week, and first thing I said is no damn PowerPoints. So we're not going to bore y'all to death with the lectures, because y'all probably going, ooh, good, because I was driving me crazy with a PowerPoint. So I do want to start with you, Chief. We're having this conversation right here. Typically, it is a law enforcement, get rid of guns conversation. Very rarely is the health aspect talked about. Speak to that, why the narrative has to change if we're to actually have a different type of conversation to achieve a different result in this country.
Well, first of all, thank you so much for having me. And it is a different twist when you think about from the law enforcement perspective and when you think about health disparities. One of the challenges that we face in law enforcement is that oftentimes the majority of where our homicides occur are in areas across the country and in neighborhoods where the demographics is really low. And what I mean by the demographics specifically, when it comes to social, economic backgrounds, oftentimes some of the children are not necessarily attending school frequently as they should. Some of these children live in spaces and places where there's unemployment, and that creates an issue for our young people. But more importantly, what I think about most of all is the fact that we have to have discussions around health, because one of the things that Mayor Bowser has said over and over again is that the safest place for our children is in school. And one of the things that we want to do is make sure that our children have a healthy mindset, that they have the food, the economics, the social, the mental capacity in order to be able to survive throughout an entire school day in school. But more importantly, when they don't have these health parities available to them, it really hinders them in their ability to be able to attain academic achievement.
Fatima, my good friend John Hope Bryan, Operation Hope, always talks about, he says you never see a riot in a neighborhood with a credit score of 700 or higher. And whenever everything the chief talked about, I have been in numerous conversations with politicians, with policymakers, and the fundamental problem that we still have in this country, we refuse to address all things she talked about that directly correlates with gun violence and crime, and because that's the hard stuff. It's easy to say, get more police officers, pass more bills, more mandatory minimums, as opposed to address all of that, which is really the heavy lifting in this country.
You hit it on the nail. These are historic inequities. We didn't just arrive here yesterday or last year. These have been inequities that have been, inculcated in the structure of our country. It's structural racism, and the disparities that you refer to. It's been decades of neglect, not only on housing policy, economic development, but also more explicitly supporting and understanding the root causes of gun violence itself. And as we discuss and we understand some of the risk factors, they're playing out in community after community, and those cycles continue to metastasize because we do nothing. So that's a huge issue. It's been thrilling to see new and deeper investment in this work, but it has to be coordinated. So there are bright spots, right? We can talk about these disparities. We can talk about the need for a whole of government approach. We want to see education stakeholders. We want to see law enforcement at the table. but the framework, right, the ability for us to all come together and say, we can address this problem, now here's how to do it, what's the roadmap, that's where we're struggling. I work to help stand up hospital-based violence intervention, so by the time our patients get to us, they've been shot already. But we're talking about children, we're talking about young adults and adults. And the level of the experiences they have coming into the hospital, the trauma they've seen, the violence they've witnessed, by the time they come to our hospitals is devastating. And being able to tie resources and support, that housing we're talking about, the school, tying it to those who are at really elevated risk is some of the heart of what we try to do.
Daniel, as she was talking, I immediately thought about when I hear these conversations, I always hear personal responsibility, need more fathers, and family. Okay, absolutely agree. But until then, you still have to deal with the reality. You may live in one of these communities, have a father in the house, have a great family nucleus, but you still might get shot. And so there are external factors here. And so if we're having this discussion with policymakers, what are you trying to get them to understand, the people who control the purse strings?
Thank you. Yeah, I think the key thing that we're trying to convey, of course, we're trying to base our arguments on actual data and research. It certainly helps that you have stories that connect to those data. The kind of things that we want to really elevate and as solutions focus on the things we see that are connected to violence. Some of them is very short term: ready access to firearms, alcohol availability. We want to convey to policymakers and the broader public that it is not just individuals who are responsible for gun violence. It is the conditions in which people live, which we've been talking about already. And so there are things you can do both short term and long term. The type of disinvestment that Fatima was referring to, we must address that head on in long-term policy solutions. In the meantime, there's great research that shows that if you address blight, if you address some of the, I'll just again say blight, vacant homes, other things of that nature, you can actually reduce gun violence pretty significantly in communities and have other positive public health impacts.
Give us an example. What cities? So, I mean, examples where that's actually happened.
So I really want to hold up the University of Pennsylvania's Urban Health Lab and Gina South and her colleagues. They have worked very closely with communities. They've studied what we call cleaning and greening of vacant lots to make actually nice green spaces for people to enjoy and come together in community, and that lowers violence. There are relatively cost-effective ways to make vacant homes secure and look like they are occupied and reduce violence.
So is that, I want to hold it, so is that because in those communities, if you have overgrown lots, vacant homes, is that a mental conditioning? And so therefore, if my community looks better, then I begin to feel better, so therefore there are different attitudes?
Absolutely. Some of that is directly related to what is this signaling in my community? Is it signaling that people don't care about who lives there and what people do, or does it signal like this is a community? This is a place where we come together, right? So I think part of it is that. There's other things that are, like people stash guns and drugs and other things in vacant homes. So some of it has to do, again, with these short-term risk factors, access to guns, drugs, alcohol, those kinds of things. And some of it is sort of the mental space of, how we feel about it. And then this connects to sort of longer-term things, too, in terms of investment. Gun violence really leads to, in addition to racism leading to disinvestment, gun violence leads to disinvestment. So we have to have effective short-term solutions to lower gun violence to allow for investments in these communities that the data indicate really pays off in both less gun violence, but more importantly, a whole range of public health outcomes that we all care desperately about, and have the same type of disparities that gun violence has.
In that particular research, though, does it give cities, neighborhoods that people can then model after?
Absolutely, yeah. The research shows examples like you do this, you can achieve these results with not only better outcomes with respect to public safety and health, but also investment. People want to invest in homes and businesses that look nice, that don't have blight. So you can show success stories in a variety of ways, some of it quite visually. So, you know, one of the things I hope that we are focused on today is how do we tell stories? How do we get this message across? And I think, you know, stories in addition to data and visuals are very powerful.
Question, first of all, for the panel, anybody can just jump in, so I don't have to direct it to you. So if anyone wants to go ahead and
I
comment.
wanted to just jump in specifically about the blighted buildings conversation and vacant houses and vacant spaces. And one of the things that I've been intentional about since I've been chief is exactly that, reaching out to the management companies, because what we know is that idle time, and I'll use this phrase because elderly folks like to use it, idle time is the devil's workshop. And oftentimes when kids are in apartment buildings, they see vacant apartment buildings and they have access to guns and things like that, they take these moments and they go inside those blighted spaces and vacant buildings or vacant apartments, and they end up having weapons, using guns, and at some point we had, and I'll use the story, we have a 12-year-old just recently who accidentally shot himself in one of those vacant buildings. And what I tasked my team with doing was really being intentional about making sure that we identify all of those blighted spaces across the District of Columbia. And then secondly, reaching out to the management company and holding some of these folks accountable, because there's an accountability piece that is also there. When we talk about making our communities more beautiful and beautifying our communities, we want to make sure that our kids can also, and young people can thrive in our communities, right? And not have spaces that are, I'll use the terminology, dark spaces for them to hide out in. We want to make sure that our kids have access, if you will, to public spaces that will keep them safe. Our Department of Parks and Recreation, right? The Metropolitan Police Department, we partner with DPR on every Friday night to give our young people a place to go so that they can have activities available to them. And more importantly for us, since I've been in this space, we took looking at data, 3 years worth of data where we had an increase in shootings and an increase in homicides, and we stood up what's called Operation Thrive, and it's our homicide reduction partnership plan. And it's not necessarily focused on heavy enforcement, but bringing in this whole of government approach, bringing in all of the government agencies, the touch points, everybody in this space, in these 3 particular areas across DC to reduce crime. And we've seen, since we initiated that beginning January 1, a 34% reduction in all 3 areas. Why? Because we're bringing out, we're communicating with our communities, letting them know that we care about what's happening in their community, but also bringing in those wraparound services to support those communities who have been impacted the most by gun violence.
But have you seen that narrative amplified through media?
So that's my job, to amplify it through media. And so
no, your job is to amplify it, but if they don't cover it,
that is true.
You're amplifying, but are you seeing that coverage? Because you'll see massive coverage of a carjacking, massive coverage of cars being broken into, but are they covering that?
And to your point, no, they're not. And thank you for bringing that point up, and I'll be quiet on that part.
No.
I'll speak. I can speak to that a little bit.
No. Here's the whole deal. I don't want y'all to be quiet on that part, because that is a fundamental part of the issue.
It is.
When you talk about this particular issue here, when you look at how gun violence is covered, if there is a shooting, you have breaking news, top of the newscast, massive coverage,
Absolutely.
Sending reporters out. Yet what you're describing, I guarantee you, a news director is saying, "Oh, that's soft news, so therefore that might merit a 30-second voice out on a newscast." But it's also important, because what you're dealing with is, from a news standpoint, they're playing into fear. And so so I believe that you should be also challenging local media, saying, wait a minute, if we did these things and it caused this drop of 34%, how are you not covering that? But you go crazy over a shooting and lease the newscast.
And we have, I'm sorry, let me just add.
no, please.
When we have been doing that, we have been challenging the media. The mayor challenges the media. I challenge the media, because at the end of the day, there are some great things that are happening to help reduce crime. And I agree with you, Mr. Martin, in that people like to amplify the negative, right? We've talked about here in the District of Columbia where we've had a 27% reduction in violent crime this same time last year, based on all of the initiatives and the efforts. And the mayor was really clear. She said, we had a 14-day
Do the people on Capitol Hill know that? I'm sorry. I'm sorry.
We had a 14-day
bad.
stint where we had no homicides. And the mayor was like, listen, you're not reporting on that. Those are the things. Thank you so much for that. Because that's the efforts of not just the law enforcement, but it's the community. And what I'll say about law enforcement, when we think about these areas where we see a lot of shootings, we see a lot of violence, it's our job to have what I like to call relationship-based policing. We have to build relationships in our communities, not one where young people are afraid to talk to the police and vice versa.
I just wanted to add, thank you so much for lifting this up and going back to our focus on media, because reporting does matter. I'm going to talk about it from a few different perspectives. The Health Alliance for Violence Intervention, the organization I run, partnered with a coalition of data scientists called CHCI to actually do an investigation of a survey of the reporting on violence segmented by race, the race of the victim, to better understand this dynamic. And what we found is that violence in Black and brown communities is often, they often dehumanize the victim. They often are not talking about it in association with solutions or opportunities for community transformation, all of the things that we're referring to here. But with other victims who are younger, who are white, even for the shooter, there's more humanization. They talk about their mental health capacity and things like that. So there are these wide disparities that we can address. This is bias in the ways that reporting happens that I think when we make journalists aware of this, that we can address. Then there's a whole other kind of media, social media. And social media, as we know, young people are not consuming newspapers or watching the local news. They're consuming media through, X and TikTok and other means. And so I want to lift up, researchers at the University of Pennsylvania, Desmond Patton, who has the SAFE Lab that actually focuses on social media analysis. How are young people and adults consuming social media and violent messages that then go from online arguments and disputes to beefs that erupt in real life? That's a huge concern, and I know that there are some departments that have units that are investigating this, or within the CVI world, there are actually organizations that monitor social media to try to get at how these disputes are erupting and what we can do to intervene to prevent violence. So there are a whole swath of opportunities for us to address this issue, but I don't want to focus just on traditional media outlets. We got to focus on social media too.
Well, they actually go together, because when you look at your traditional media outlets, they still have massive following on social. And so,
Absolutely.
and when you look at social media, a lot of the content is being generated by traditional media. So even though it's on social, you don't have. We know exactly where it's coming from, and so part of this thing, I dare say, Daniel, is just, again, what we are being bombarded with. And so when you're bombarded with okay, oh my goodness, this shooting, the natural reaction in this country consistently, I don't care what part of the country is, oh my goodness, increase the police budget, flood the streets with cops, and then in significant red states, allow folks easy access to guns. And that really is the conundrum that we are in. You cannot continue to have a conversation about how do you confront gun violence when you have lawmakers whose sole focus is to make it easier for folks to be able to access guns. I mean, we just saw in the last 2 years where they got rid of even the need to get permits in Texas, in Florida, and states along those lines, and that makes it a hell of a lot harder to cause reductions.
Well, you clearly identified the biggest challenge that our center grapples with on a daily basis. And it really connects to the challenge that public health faces generally, because the whole set of social processes and narrative is driven by us thinking about a problem only in individual context. Some shooting occurs, and the media and everybody basically asks the question, what could have happened to save that victim? And it's easy to imagine that if that person had a gun, that they could defend themselves. Rather than a communal-oriented examination of the problem and say, what went wrong in this community that, and the policies that drove those conditions that allow this kind of violence to happen with such regularity. So our challenge is a broader challenge that public health faces of basically how do we build community? How do we have individuals come together and act collectively? And this is something that the field of sociology has been holding up for decades now, this idea of what we call collective efficacy. Can communities come together to solve the problems, and can the people who represent them help them solve their problems? And so, to state the obvious, they're not just data-driven solutions. They're political forces at play that we have to recognize and come together around to say, no, we have to act as a community. Our communities are fraying, and it's the narrative that it's everybody for themselves that is driving not only gun violence, but a whole range of health and social issues.
From a data standpoint, in any of the stuff that y'all have studied, do you have anything that shows if you do what the chief described, it's actually more cost-effective and cheaper than the amount of money people are paying somebody gets shot, they're going to a public hospital, taxpayers are having to pay for that, in addition to police, all those things that go into it. If anything that shows that, because let's just be real clear, there's only one federal agency that shares along with the White House. That's Treasury. That's money. And if you're not having a money conversation, you're not having an American conversation. And so you have to actually also deal with the money aspect. And so if the data shows that, I think that's also part of the narrative by saying, folk, if we do these things over here, it's a hell of a lot cheaper than doing this over here.
Yes, and you can really make that argument quite well because we have data showing just the enormity of social economic costs connected to gun violence. It turns out, honestly, almost anything that is effective in reducing gun violence is cost effective because it is so costly. I published a study several years ago studying community violence intervention in Baltimore, and showed some positive effects in reducing gun violence through programs called Safe Streets. And these workers sadly aren't paid enough. And I just did a relatively modest, comparison because we were simultaneously studying policing and the effect of policing in these communities. And you got basically the same beneficial violence reduction from community violence intervention that you got from a much more costly, hotspots policing. Not that we shouldn't do that, but I'm just telling you that when you compared those...
But how dramatic? 2-to-1, 3-to-1? How dramatic?
It was about 2-to-1, yeah. But again, this is relatively back of the envelope kind of thing, but it was stark because at that time in particular, we had, I think, 4 neighborhoods with about 5 workers in them getting paid very little, sadly very little, in comparison to year in, year out, millions and millions of dollars in law enforcement. And look, there is a need for law enforcement. I don't want to pretend that there isn't, but there are other ways to lower violence than just law enforcement.
But see, but the reason I'm asking the question, because I think part of the issue is from a public standpoint, most people are not armed with facts, not armed with those level of solutions. And look, I've been on television for years, and I can guarantee I know exactly what folks are going to say and lay out. And then when you're able to say that, now people walking out of here can go, hey, I can cite this example. And it's not even in when you say we need law enforcement, here's the whole deal. I can show you, again, I go back to what John Hope Bryan said, show me a community where you have high income, where you have high education, where you have high health outcomes. I'm going to show you lower police presence. And because of all of those factors. And I think we have to learn to use different ways to communicate this. And if I can articulate economically, you do this, it's cheaper than this. Those folks out there who are fiscal conservatives or people who say we're spending too much money goes, oh, wait a minute. Maybe I'll try that even from a pilot standpoint, because that's rarely ever talked about. Chief, I think you wanted to jump in there. You grab the mic.
I did. I think you also have to change the mindset of the folks who own the properties and own the community establishments and things like that. Because if they're not investing, I'll use for some of these apartment complexes and housing complexes in certain areas across a city, right? They're not reinvesting in those spaces, and so when they don't reinvest, then you have the violence and the increase in crime. And I'll tell you, and to your point, I have to provide lots of resources in areas where we have high crime. I mean, it's just evident. And when you talk about money, yeah, there's a lot of money that goes into that because there's overtime, and then there's other things that we have to invest in that. One of the things that I will say is that I pride the Metropolitan Police Department is that we're one of the few agencies who have a youth and family engagement bureau, where our primary focus is to be out in the communities, working with young people and their families to really shift their mindset. And what do I mean by that? I'm glad you asked. So when I was coming up in school, we used to have this program called Officer Friendly. And that was really the key component to really working with our young people and changing their thought process, because by the time they get to the 11th and 12th grade, their minds are already made up. So I brought back the Officer Friendly program here for our middle schools here in the District of Columbia, because it's really important that we start with our young people and changing their thought process, because if we can connect with them, then we can also get them to think differently. By the time they get to the 5th grade, they're looking at ways on how they're going to create a path for their lives. And some of these kids are basing their decisions based on influence. I heard you talk about social media and TikTok, and everybody in this room knows when the TikTok video came out about how to carjack Hondas and what's the other car? Kias. The whole United States of America went into complete pandemonium, right? Why? Because of the influence, once again. And I'm proud to say today we have a 34% reduction in carjackings based on the fact that we stood up a carjacking task force, we stood up a robbery suppression initiative, and again, those are enforcement tactics, but we're also meeting young people where they are in our schools. I'll highlight one other thing. I'm a member of the National Organization for Black Law Enforcement Executives, which is NOBLE, and I'm an active member here in the Washington, D.C. chapter. chapter. One of the things that we do with Noble is that we go to the schools and we talk about a program called Law in Your Community, right? How you can interact with law enforcement personnel so it's not adversarial on an ongoing basis. And I think by, again, promoting some of those positive things that young people can see in those areas where they don't get a chance to see positiveness, right? I've also engaged with some of the football players and some of the coaches around the school campuses, because I come from a space where I was in sports. I was a track and field. Having mentors and you talk about not having father figures. A lot of these young people don't have father figures in their lives. I've gone to some of their homes where they don't even have food in the refrigerator. And we're talking about 2024. That's a shame. That's a shame. And it's a tragedy, which is really important for me. My team knows I will pick them over and over and over again when it's a family that we know needs help and needs support. For me, yep, there's the enforcement piece, but I am so passionate about making sure that we develop whole leaders and whole young people in our community.
Fatima, that last point I think is crucial when the chief talked about food. I've been covering all the battle over the Farm Bill on Capitol Hill. Republicans want to cut SNAP benefits, which are about $6 a day. You hear complaints about, there's waste. Frankly, there's more waste in the Pentagon there is in the SNAP program. And I've had conversations with numerous teachers. In fact, my brother, three of my sisters have been teachers as well. And the average person has no understanding when they say, well, these kids are coming to school angry. How many teachers have said to me, yeah, but you have no idea they only had one meal or maybe didn't eat the previous day. And so now you take somebody who is at 7:30 in the morning, on edge, pissed off, not happy because they're hungry, and all of a sudden fights escalate. All of those things have an impact, again, on gun violence. Speak on, again, trying to convey to the public, but also the policymakers, that you might not think a person who's hungry has a direct role in gun violence, but it does.
Absolutely. As someone who's experienced homelessness as a child and went to school hungry, I can tell you firsthand, you can't learn if you are hungry. If you are worried about your next meal, if you're rationing, we put food in our pockets. It's not a condition that lets you know that the world is safe enough for you to do the things that children typically do. And you grow up to mistrust everything, every institution that claims to help. Their anger is so profound. But I want to go back to what Daniel said about we've got to hold in our narrative the storytelling of those individual experiences along and supporting individuals with structural policy change. And that's what you're talking about. And we talk about this in the hospital context because, again, by the time our patients come to us, they've been shot. They have been failed by every system over and over and over again. They get shot. Young people with housing instability, 2.5 times, black and brown people, 2.5 times more likely to be exposed to violence with housing instability. So highly, highly concentrated in our communities. Hospitals will say, all right, well, our job is to treat this patient. They've been shot. We'll, sew up their physical wounds and we'll send them back out in the same exact environment and call that health and healing. No, we have to redefine what we mean by health and healing. And so I'll give you an example. We have really advocated for hospitals and health systems to invest their own dollars in food deserts. So I'll lift up Boston Medical Center. They had an entire investment strategy identifying food deserts in communities that are disproportionately impacted by economic disinvestment, violence, and created a grocery store and created business with the health system to keep the economics up. That's key, right? Then they become a vendor for the hospitals and health systems have a role to play beyond just treating individual patients. They have a whole government relations arm and can be advocating alongside us for these larger policy changes.
And typically are some of the biggest employers in that area.
Employers, pipeline programs for nursing, for a whole host of things. And they're in every community, right? We have hospitals and health systems systems as anchor institutions. So there's more that these stakeholders can do, and we need to hold them to account for those structural work as well as the individual work.
We're going to do some questions go ahead. Opportunity for y'all to ask some questions as well. And so we have folks with microphones. Where are you? Okay. You got the microphone? Who has a microphone? Okay. You stand right there. Who's on this side? Oh, you're right here. All right. So we're going to go bounce from side to side. So here's the whole deal. They got the microphone. We don't need you to touch it. We don't need you to hold it. Just put your hands behind your pocket. 2, we don't need sermonettes. So we have questions, and trust me, I've hosted numerous radio shows. I will cut you off if you get long-winded. Just letting you know right now. So don't let me embarrass you in front of everybody, because I will. All right, we're going to start on this side here. So I want you to step out into the aisle, ask your question. State your name, where you're from, and your question.
All right, good morning, Davon Love. Leaders of a Beautiful Struggle in Baltimore City. One of the things that was mentioned, you mentioned, media narratives and how they influence policy decisions that focus on mandatory minimums, sentence enhancements. One of my disappointments in some contexts with the emergence of public health as the dominant kind of violence prevention alternative is not enough attacking the way that the media, and particularly in Baltimore, and I know this is true around the country, Sinclair Broadcasting, Fox 45, putting out messages about carjacking and demonizing safe streets, demonizing community approaches to violence prevention. And so I guess my question is, what are some additional things that can be done or should be done? And why do you think that folks in the space aren't as, vicious, I would argue, in attacking Fox 45 and Sinclair Broadcasting? It seems to me, I think people are scared. And that's my concern, that if we're not as aggressive at attacking Fox 45 and Sinclair Broadcasting as they are attacking, community-based violence prevention, then it's creating an environment where our legislators are not going to support this approach to addressing violence.
Go ahead.
You said it all. I really appreciate you framing it that way. It's something that's really missing. I was trying to look up as you were talking the name of the center. It's based in Philadelphia. It's a journalist who's John. I think it's John Milligan. I'm sorry, John. I'm forgetting Macmillan. He has a center that focuses on this very problem. He was a journalist for decades. Did the crime beat in Philadelphia, and talks about the transformation he went through as a journalist from reporting in the ways that journalists are taught, right? This is going to get headlines. This is going to catch people's eyes and, advertising dollars. You report crime like this, to an understanding that there's a crime prevention strategy that includes journalists, that actually includes the media, and that to neglect the media's role is actually harming communities. It's a really powerful frame. And so he has journalists through his fellowship who shadow violence interrupters in community. And of course, cities across the country are like, we want this program. You can't grow fast enough. But I think you are absolutely right. It's a huge gap, and it's something we have to scale alongside these solutions, because if people don't know it's happening, we run the risk of exactly what's happening in Baltimore, this negative press, and then suddenly people don't want the things that work, and that's a huge
Well, the difference here is that particular station is owned by Sinclair Broadcasting, and Sinclair Broadcasting is a far right-wing in terms of their leadership. And so this is actually their strategy all across the country. And they are one of the largest owners of television stations in the country. And in fact, the chairman of Sinclair just led the purchase of the Baltimore Sun. And so now not only does they control the Fox station, they also now control the city's newspaper. And he is very much about driving this messaging, because that's literally their business plan.
Can I just say one thing about this, excuse me? Because you're absolutely right. It's a huge issue, but that's an issue across all social areas. We have a lot of narratives that are getting fueled by conservative leaning stations. It's a huge concern.
No, they ain't leaning.
I'm sorry. Far right,
Dang,
far
man.
right, far right. Thank you, Roland. I appreciate that.
They
But
laying.
they're
They
all
not
the
leading. They're laying.
But right, the general population, right, we can be inoculated. We can filter. We do it all the time. And what we don't have with gun violence that we might have with other issues is other messages that are louder that can counteract those. We don't have that with this, and that's the issue. That's what you're talking
Well,
about.
what you have is that, but here's what we do have. And this is the strategy that most people don't really pay attention to. There's no television station, there's no newspaper that can survive without advertising. And so the challenge to them would be, okay, since you don't want to listen, we're going to go to your money source. And then we're going to go to those companies that are advertising on your news stations and begin to say you are funding the nonsense that they are putting out. It really is. That's going back to, frankly, Operation Breadbasket. Dr. King, Reverend Leon Sullivan out of Philadelphia, who gave him the idea, because trying to get to those station leaders, that's coming directly from corporate. And again, the Sinclair chairman is from Baltimore County, so he's right there. And so the attack is you go after. I keep going talking about America. You go to the money source. You hit their money. It changes their attitude. They start seeing a drop in revenue because of that type of coverage. Then all of a sudden, they start reconsidering in terms of how they look at various issues. And so, to me, an organized effort targeting one of their sponsors and then methodically going after them has an impact, frankly, on that type of coverage. Go ahead.
Just very briefly, I want to say to Davon, I appreciate your advocacy, everything you've done for Baltimore. And, you know, your message is hitting me, okay? I will say I will never turn down an interview request from those outlets and tell it like it is. And I've been trying in a variety of different spaces with data, right, to show the beneficial effects of investment in community violence intervention. But it's sort of a fine line to walk about how much, as an academic researcher, to sort of go after a media source rather than sort of the ideas themselves. And I'm going to do some more thinking on this, but to your point, I don't think me, Johns Hopkins, or anything going after Fox or Baltimore Sun is going to change
Not true.
anything.
Not true.
No?
No, I'm trying to tell you. It's absolutely
Okay.
not true.
All right.
Here's the mistake that I think we have to understand. The media is the second most powerful institution in the world. If there's ever a coup in any country, they get control of the guns first. Military is always first. Media is always second. Always. Because media controls the hearts and minds. I can guarantee you, and we've seen this, a certain type of coverage can literally shift the mindset of the general public.
You're absolutely correct.
By constant reinforcement.
Yep.
That's a reason why Fox News does what they do, straight out lying, because they're speaking to a particular audience. And so it's the constant reinforcement. I've been in media since I was 14. I've literally seen it when you watch cable news. There's a reason why they only focus on 3 stories a day. They got 24 damn hours, but it's 3 storylines a day. That becomes the dominant narrative. And so they're driving it. And so it's 2 things. 1, you have to call that out. But 2, you have to then say, okay, how do you really fundamentally change it? And it is hitting their economic source. If you go back to the Kerner Commission report in 1968, LBJ asked them to study the race riots. Now, they couldn't agree on a whole bunch of stuff. What they did agree is that one of the fundamental causes of the riots, first of all, nearly every riot in the 60s was driven by police abuse. But they laid out that the media played a huge role and the lack of diversity in it. So the first wave of black folks coming into national media was after the Kerner Commission report, where they said there are two Americas, one white, one black. So oftentimes we talk about media, but I don't think most people really understand how deep and penetrating media is and how media drives so many different things. And so because I understand it, how I do media differently than other people is because of that. But they have to be called out on it. You could then you're a researcher, y'all are researchers. I would say do a content analysis for 1 month on their newscasts. How much time do they spend with crime? Second, how much time do they spend with, you can call it negative news or whatever. So if you take out weather, if you take out sports, they do little entertainment. I can guarantee you, you're going to see a significant amount, a high amount of crime, mayhem in their newscast. And imagine, that's the morning newscast, that's the midday newscast, that's the 4, the 5, the 6, and the 10. And because of their now add on the Baltimore Sun, and then what happens is one station, and it's happened when I was at CNN, this station could actually drive the editorial decisions of the other stations. That's how pervasive media is, and that's how deeply penetrating it is in our society. And again, as somebody who's been in the media since I was 14, this is literally how it's done. And Tim Reed told me this story. He had a meeting with Bill Paley, who was, of course, who led CBS. And Paley asked him the question, what is your propaganda goal? Tim said he had never thought about how his show Frank's Place on CBS was propaganda. He said, what is your propaganda goal? And depending upon who is in charge, whether it's Rupert Murdoch or Ted Turner, that person is dictating what is your propaganda goal. How are you using media? And so it is extremely pervasive depending upon who holds the weapon.
And it's also important, and from a police standpoint, it's also how we also brand.
And
our
also
narrative.
Sinclair owns Channel 7 here in D.C.
Yeah, I know. and I say that,
Point proven.
yeah.
Go ahead.
And I say that you're absolutely correct, because last year and I'm citing examples. City under siege. It's all you heard about D.C. And I was just like, God, dog, is it that bad? Like I live here, and it just can't be that bad, right?
Oh, people were tweeting me, Roland, be careful. I'm like, what the hell y'all talking about? Oh my God, they're getting carjacked. I'm going,
But they were.
I walk to my car every single day. But that was literally the perception that was driven.
Absolutely. It was almost like every day. And then I had to talk to, because I have a public information team as well. We have to approach them with a different mindset. There are positive things that are going on with law enforcement, outside of law enforcement, within our communities, with young people who graduate and go off to college, and Ernst & Young is providing scholarships for our young people. There are positive things that are happening. And what we have to do, to your point, young man, and I appreciate you framing that question as well, is that we have to approach them with a different narrative, right? We have to give them the story sometimes. And to your point, Roland, is that we have to change their thought process, because I'm like, I live here and I know good and darn well we're not a city under siege. Now, don't get me wrong, crime was off the chain there for a moment, but nobody's knocking on my door, watch the text, today talking about the 27% reduction in violent crime.
Oh, no.
They don't want to talk about
that. Won't leave the newscast.
Of course it won't. But I just say that to say thank you for that question.
Yeah,
Very
absolutely.
important.
Next question, what we got on this side over here? Sister, step on out. Come on. You like this here. I don't know. I'm going to ask a question. I don't know. Put your hands off the microphone.
Oh, my bad.
She got it.
My bad. Hi, I am Tia Watts. I'm a second-year MPH student at Meharry Medical College and a New Orleans native. So in the beginning of the panel, you all talked about blight. I was born in 2000, so I was there for Katrina. Blight is still a major thing in major cities. I've seen and experienced what blight does to the community, especially with the increasing crime rate in increasing suicide rate. We're in the middle of Men's Mental Health Month and everything above. Also, both my parents were in law enforcement for collective 20 plus years. So I've seen the flip side of the coin. What do you tell the graduating NPH students? What do you tell us? How do you encourage us to move forward and progressing? Because at this point, you all talked about that roadmap that's not there. How can we be included? Because we're a new generation. We have the social media. We know how to manage that. But sometimes it's a little hard when you have people in higher places who, for lack of a better term, might be set in their ways, in their own methods and methodology. So what do you say to that?
I'll start. People who are set in their ways can lose. So the problem that most people don't think about, you are a voter. Most politicians, they're fine with one or two people complaining. When all of a sudden 50, 75, 100, 200 show up on a consistent basis, all of a sudden their attitude changes because they see votes. One of the greatest mistakes, which is why if you saw the type of questioning, you have to connect the dots. And so the point about blight, impact on mental, green space, providing opportunities, all those go together. So you have to connect the dots. So part of this piece is, and I spend lots of time on my show talking about mobilization and organization. And so most people are operating sort of as individuals. What they're not doing is they're not operating in terms of from a group dynamic. So I had the benefit of two parents who never went to college who were founders of a civic club. So I saw at 7, 8, 9, 10 how they changed new sewer systems, new street lights, new sidewalks, all those things, because they mobilized a community and they organized and they then went after all of the things the chief talked about, what Team and Daniel talked about, and so that's part of the piece there. But I can tell you, it will not change unless you mobilize and organize, and so there has to be that sort of effort. Otherwise, you're sort of one individual saying, "Hey, what's going on?" But when all of a sudden a community begins to get mobilized and organized, an elected official responds because they go, "Oh, I might lose re-election," and so that's the currency that you have. Anyone else want to jump in?
I'm just going to say a loud amen to what you just said. You nailed it. Your public health training is an important power to channel in the directions that were just described. We do have solutions. Learn about those solutions and learn how to organize power with community. And you can make big changes.
And last thing, again, I cover City Hall, I cover county government. So I'm used to people bitching and moaning. What they rarely bring, though, is a plan. And so if you, in your capacity, says, "Hey, this is what I see, here's blight, here's how we can change this community based upon the research," all of a sudden, now they're forced to have to contend with an actual plan, and now you can say, are you going to adopt this plan? Now all of a sudden, it's not just, my thoughts. Now all of a sudden, they have to contend with a real, live plan of action that could change a community. And again, you can then recruit others to then mobilize around that particular plan to put pressure on those policymakers. Question. Here we go.
I didn't touch it. Good morning, Roland.
You want to grab that microphone
I was
so
trying
bad.
so hard.
I mean, she over there like, oh my God, just put your hands behind your back. Put your hands behind your back.
Yeah.
Assume the position. Put your hands behind your back. Go ahead.
Well, good morning. My name is Claudia Bellany. I'm a Hopkins alumna, and I work in international economic development. Just to your first point about the media narrative, I actually had to email the Maryland Independent and Southern Maryland News on the perceptions that they were making of Black men on the banner ads on as soon as you open the publication, it's a scrolling circus of black men who've been arrested for gun violence in some capacity. I said, why is it as soon as you open on the landing page, that's all you have to highlight? You're not highlighting the wonderful things the black kids are doing in the community. My question, so that was my comment. My question is, what does the data talk about or the research show for more affluent American communities, that the kids are growing up in two-parent households, upwards of $100,000 in household income, high educational attainment, where they're also aspiring, they're getting influenced by TikTok and Instagram and the imaging and the perceptions and their kind. I hear the conversations and I'm like, you guys are on the math team. You have 4.0s, you're in honors classes, and there's like this dichotomy between this violence culture and trying to be a good student. Juwanza Kunjufu talks about the black peer group. Can you talk about the research?
To be honest, I'm not sure what specifically your question is. It the more affluent youth? What? I'm sorry, I didn't.
I think there's a gap between, you all have talked about pervasive poverty, anger, impacting gun violence. There's also a population of African Americans kids that are growing up in wealth, but they're also being impacted by violent perceptions, and they also are angry, but it's not necessarily correlated to hunger and my dad's beating me up and I'm in an abusive home. A lot of it is the perception of TikTok and the media, et cetera. So what does the data show about those communities and the correlation with violence and gun violence?
Well, very briefly, we're seeing basically all youth having greater mental health challenges in recent years, and we're also seeing remarkable and sad increases in suicides among African American youth, and the growth rate is among individuals, youth who are black, is now greater. And so I'm sure all of the negative forces that you outline are part of that, but it underscores, gun violence touches us in different ways. Some of it, most of our conversation right now has been sort of assaultive violence, but the most common form of firearm death is suicide, and there's the trends underscore disparities there. I honestly don't know about the income dimension to that. We need better data to understand that better. I don't know if anybody else said.
This is kind of maybe related. I'm thinking about Raj Chetty's work on economic mobility and looking at the influence, some surprising findings around middle-class black households, two-parent households, and their success continuing in the next generation of maintaining or growing that wealth, that there are some significant racial disparities in economic mobility, and they're really struggling to understand why, and some of it has to do with perceptions of people's ability to go for the bigger jobs, or there's a whole host of things, but the mechanism, I think, is pervasive in society, and I think some of the influences you're describing are part of that. A lot of a dimension of this that we're speaking around, but I think when I say more explicitly, is that we're impacted by our peers. Our social networks really shape our experiences. And while economic mobility is a really powerful driver for your opportunities, the things you understand and your peer group understands as access to opportunity is greater, it may not be as great as we originally thought. And there's a New York Times article, I think that came out last year, that actually does an incredible graphic of economic mobility across race. And you see folks, black men in particular, where their mobility will decline, even though they've had parents, college-educated parents, great schooling, great educational attainment. And again, people are trying to figure out why that is.
Gotcha. About 3 minutes left. I don't give a damn about my peers. I don't care about them. No peer pressure. All right, we got 3 minutes worth of questions. Question, right up, girl, put your hand down. She got it. She got it. Question right here. Go.
Okay, good afternoon. My name is Finesse Muya. I am currently, I recently graduated with my MPH and I'm currently a pharmacy student. I wanted to continue on the same trend on social media and gun violence, but in the sense of famous rappers and singers, because most young people do not watch news, but instead scroll on TikTok and Instagram and YouTube, which helps influence their behavior. So how can we engage prominent social media influencers, particularly rappers, with significant media influence to actively discourage the portrayal and promotion of firearms and negative behavior in their music and online content? I believe by leveraging their platform, they can positively influence youth and contribute to a reduction in gun violence. But instead, all they rap about are like all they rap about is nonsense.
We know. I'm going to go back to what I said about Fox 45. A few years ago, CNN had a conversation. It was a discussion, 2-hour thing about rap music. Paula Zahn was hosting it. And frankly, I got pissed off because I was tired of it, because the whole thing was about rappers. There wasn't a single question posed to the record label owners. So again, we're attacking the problem from the wrong directive. Michael Jackson put out a record where there were some comments that were critical of Jews. The album was destroyed, and then he was ordered to put out another different song. That came from the record label. So I'm going to ignore the label, because even if you take a label, they have a distribution deal. So if this label is putting out certain music, no. Who's the distribution company? Target Universal. Target those executives. And so that's who we target. Also, some of these are publicly traded companies. Now, what often happens is, and there was a huge battle, if you go back, see Dolores Tucker, Reverend Calvin Butts, when they were highly critical of gangster rap. They were going after NWA, and a lot of people were going back and forth. And I'm gonna say this because people don't want to deal with it. Anytime you hear record labels talk about black artists in what you described, they will discuss the art. But you have never, ever heard a single artist use a racial slur that targets LGBTQ or folks who are Jewish. Why? Labels are not going to allow it. We have to have the same standard. We shouldn't fall for the art piece. We should tell the owners, why are you allowing it to be distributed? And so I agree with you holding artists accountable. Target the owners of the labels. And too often we leave them out of this conversation, and they're never held accountable.
So how are you guys targeting them?
Huh?
How are you guys targeting them?
Well, again, you target who's the head of Universal. You target in terms of, and ask them the questions as well, not just the artists, because that's bottom up. I rather deal with top down, because at the end of the day, they can make the decision whether to put something out or not.
That's true. Thank you.
Let's thank our panelists. Thank you so much. We've got a 10-minute break. There are restrooms that way and that way, and 10-minute breaks. And we would like the panelists to actually take pictures. So if you would stay up here, and everybody else gets a 10-minute break. Thanks. Photographer, raise your hand. Okay. The photographer is right there in the center for those who are on the stage. Yep. Back. Thank you so very much, Mr. Roland Martin. Didn't he do an excellent job on that first panel? Let's give him a round of applause. He is going to actually moderate the second fireside chat as well. And as I read the bios of our distinguished guests, I would ask that they actually come to the stage so that Roland can begin the panel or the fireside chat. Mr. Rodney Bryant is the 46th national president of the National Black Law Enforcement Executives. He is a longtime advocate for gun violence prevention and a well-trained and sensitive police force. Mr. Bryant entered the Atlanta police force in 1988 as a patrolman and rose to become the city's 25th police chief before his retirement in 2022. Welcome, Mr. Rodney Bryant. Miss Angela Farrell Zabala is the first ever executive director of Moms Demand Action and a mother of 4 children. Angela is working to ensure that all children remain safe from gun violence. A longtime volunteer and grassroots organizer, Ms. Farrell Zavala has had the chance to work on several important causes, including women's rights, civil rights, LGBTQ+ rights, immigration, reproductive rights, racial justice, and education. She is an advocate to her core. Please welcome Ms. Angela Farrell Zabala. Dr. Nicholas Scott Meyerson is a research associate at the Johns Hopkins Center for Gun Violence Solutions. His research focuses on the effect that gun violence has on communities and equity-centered community-based solutions to gun violence prevention. So our panel, please welcome Nicholas Scott Meyerson. So we're moving to the advocacy, community experiences, and practices. Turning it over to you, Roland.
And we're back. All right. My appreciate it. Angela, I want to start with you. Walk people through the effectiveness of Mom's Group in terms of, look, you were going up against this huge beast, the NRA, and constantly being demonized. Then you had people who were on your side saying, y'all can't beat them. Y'all can't win. But walk folks through how you had to build to get to the point of where you are now.
Thank you so much. Can everybody hear me? Good morning to all of you. Thank you so much, and thank you, Roland, for that question. So Moms Demand Action has been around for over a decade, 11 and a half years at this point. And, you know, it was not easy, as you said. This issue, when we think about gun violence prevention in this country, which is a public health crisis, was the third rail of politics. You couldn't have a conversation about this when you're thinking about elected leaders. Even a quarter of Democrats in Congress, Congressional Democrats, were kind of aligning with NRA because they knew that was the way that they would get elected.
And it wasn't just Congress, it was state legislatures. It was
yes.
Local people as well.
It's so many people. And we really had to dig in and push, to find our way. I think I would credit a lot of this, and I will just say this for any survivors that are amongst us. Survivors are the key to this, because elevating and hearing their stories, understanding how this has devastated communities, there was just, no more on the sideline. And so we had mothers and others, we like to say, students, young people, faith leaders, veterans, all stripes, get up and say, enough is enough. This is now the leading cause of death for teens, kids, and young adults in this country. And so what it meant was real grunt work, unglamorous, heavy lifting that had to happen. Talking and having conversations with anybody and everybody that would listen, including elected officials. And what I'm proud of in this time that Moms Demand Action has been around is that we have a lot of our volunteers. We're in all 50 states plus DC right here. And in fact, I got to meet a lovely volunteer from DC that showed up here today. Instead of just advocating for good policy, they decided to organically run for office. And we created a program, Demand a Seat, to actually help to build the competencies so that they could lead incredible campaigns and win. And so now, not only are they advocating, they're writing good policy, and we see that across the country in many states like Michigan, Minnesota, Colorado, Illinois, just to name a few, where our volunteers. So we have a full arc from really being underdogs in this game to showing up and showing out from school board all the way up to Congress, and one of our original volunteers, Representative Lucy McBath, and really making our voices heard. So it really takes every single person jumping up and stepping up to do what it takes to change this crisis in this country.
I'm gonna come back to some of that, Nicholas. What you just heard her describe is frankly what I was saying earlier. It's mobilization, organization, and I think if those who are in sort of this health space, they have to be thinking the exact same way. The approach can't just be here's research, here's data. It really has to be how do you organize and mobilize researchers and folks in the sciences space to do the exact same thing in states, dealing with Congress as well. Can you speak to that?
Yeah, of course. Thanks, Roland. It's quite much brighter up here than it was in the crowd, but I think when it comes to
these soft lights. These
are soft lights.
Soft lights. Much brighter. Go ahead. It's soft.
When it comes to researchers, I think it's important to acknowledge first how the relationships between communities and these universities. For example, being at Hopkins, the relationship between Hopkins and the city of Baltimore is poor, but for a reason. So I think when it comes to researchers thinking about how to talk to individuals, how to talk to policymakers, how to talk to community-based groups, it's one, acknowledging the historical relationships that already exist there in order to do a better job at communicating. Because if you're going to go with this level of distrust, that is for a reason. It's really trying to first know what is at the basis of the relationship, how can we fix that, and how can we come together to advocate and to actually create policy and solutions that will actually address this issue.
And Rodney, he talked about trust. Obviously, mistrust. Noble, again, for people who don't know, I do, explain to them, though, how Noble has been able to have the trust of the community, being law enforcement, and being able to speak for them and with them when it comes to a variety of issues.
Thank you so much. Noble has been around since 1976, so we're actually 48 years old. And one of the things that we pride ourselves on is making sure that we are getting back into the communities and establishing that relationship with the community. The uniqueness of our organization that differs from many of the other law enforcement professional organizations is that we have chapters that works in the community. Many of us are from the communities that we serve. Myself, I'm from the Georgia chapter. I am the national president, but I'm in the Georgia chapter. I grew up in the city of Atlanta. I was the police chief in the city of Atlanta, and I continue to work in the community. And that's what we do. We establish relationships in those communities. We additionally have, as Chief Smith spoke about, our Law and Youth initiative, where we are going into communities, working with other organizations to go in and have conversation as it relates to how we can respond and react to the police officers that we encounter in our community. And that's something that we, as well as when communities find issues where they are having trust issues with their law enforcement. We were on the ground in Ferguson right after that initiative. The incident in Ferguson, Noble was requested. We went in and established a different relationship with that community as well.
Angela, when you talked about, again, it was a slog. I think, and this is no disrespect to generations, but the reality is I think that there are people who believe, we can get together, we can do stuff together, and in about 6 months we're good. And
I wish it was like that.
That ain't happening. and I have to remind people all the time that if you're going to be committed to this, understand you have to look at this from a 8, 10, 15-year perspective because it takes a long time to shift public opinion, to get people to think differently. When we talk about this issue of gun violence, for the longest it's been a black and brown conversation. But what also began to happen is you started having white women, white mothers who start losing children. And we saw this in Tennessee with that shooting there, where you had white women who were coming to the state capitol protesting in a way that we've never seen before. And so talk about on this particular issue how folks in this audience have to look at this not from a black-brown perspective, but also understand that you got to have white folks who are impacted by this as well to say this is not just an us thing, because we know policymakers in many places, if it's just black-brown, they're not going to pay attention.
That's absolutely right. And I would just look at this from a continuum. So when you talk about, and I have 4 children, my oldest will be 23, the twins, boy and a girl, in August, and I have these conversations often, especially
You
my
ain't got
son.
no 23
I sure do, Roland.
Stop front.
And then I got an 8-year-old and a
Stop
6-year-old. I got it. Well, my son in particular, we have some pretty intense discussions because he's just doesn't understand how to jump into, with his mother, who I've been organizing all my life, how to jump into politics or jump into organizing, right? And so it's a continuum. But before I really answer this, I want to just pay homage to the folks that came before. You mentioned this. Black and brown leaders have been on the ground doing this for decades, because they had no choice. They had their people, their communities were being devastated. Our communities were being devastated, and we could not wait for Superman. And so there's plenty of folks that have been doing this well before Moms Demand Action came on the scene, so I just want to honor that. But to your point, we do have to all jump in. This is an all-hands-on-deck moment. This is a public health crisis that can impact any and every person. A bullet does not care about your zip code, your race, your education, or anything else. And so it is important. And unfortunately, what happens, we see an increase in our membership when we have big national tragedies. And those are the ones that we see on the news, right? You talked about the Covenant school shooting. That was Tennessee. And I work very closely with women in Tennessee, survivors, Republican, wealthy women that are now like, oh, hell no, not my kids. And, when I had some of the conversations, and I'm the kind, as an organizer, I will talk to almost anyone, because I really want to meet people where they are, because we need everyone, all hands on deck, to solve this crisis. And I remember talking to one of the survivors, and one of the first things she said to me was she was apologizing. She's like, I'm embarrassed, and I'm so sorry that I haven't been doing this. I haven't been on the scene before this. And I said, you showed up today, and we need you today, so let's figure that out. But it is going to take every single person doing any and everything that they can to get this. Again, this impacts everybody. But like you saw in Tennessee, we get to look at what our skills and what our abilities are, and we really get to leverage those things. So if someone is really good at public policy, we can jump in with that. If someone's good at communications, if someone's good at organizing. And what these women were able to do was galvanize their community. Galvanize those community, and also get the earned media and the attention showing that this is a problem. And so they showed up when Tennessee was ready to arm teachers, which they did pass. These women and our volunteers and other folks that have been around doing this organizing all showed up and showed out. And you know what this means? Even though they passed arming teachers, not one school district so far has opted in, because the organizing continues. It does not stop.
So the folks who don't, again, and I want to walk through again the mechanics of when I was talking about earlier, organizing and mobilizing. So they knew it was going to pass, but then they lean on those school superintendents whose jobs are dependent not by the legislature, but by those school board members. And each one said, yeah, not going to happen, not going to happen, not going to happen. But you said something earlier, which, and I don't want us to overlook that, and that is what folks in Tennessee realized, the number of people who ran for re-election every year, and they had no opponents. So one of the things that y'all have been able to do is get people to understand you can't just protest to the policymakers. You also have to run people against them.
Build that bench.
There you go.
That's right. We got to build the bench. And we have an intentional program now called Demand a Seat doing exactly that. And in Tennessee and everywhere. And we're looking at everything from school board all the way up to U.S. and federal offices. So it is really important. If we don't like what they're doing, we hire them. They work for us. So that's why it's important. We have a critical election, and we say that every time, Roland, we're saying this is an election of our lifetime, but it's serious. Elections have consequences, and we want to think about it, not just the presidency. We're thinking about school board. We're hearing a lot about even books, like what books you can have, what you can teach. arming teachers, all that is at stake. So we not only are advocating at the State House for the public policy we know is going to save lives, but we're running our folks for office because if you're not going to do the right thing and have the courage to stand up and protect communities, you're out of here and we're coming in.
Rodney, a lot of folks don't even pay attention, who don't pay attention to politics, don't realize that in local races, especially city hall, county government, the most sought after endorsements are police unions, fire unions. And so how have you worked with other organizations, Fraternal Order Police, Sheriff's Association, to get them to understand that if you want to deal with gun violence, the solution is just not just throwing more law enforcement dollars at it, and also not just trying to arm more people, but really getting them to understand Noble's perspective. How have y'all done that?
So that's a good question, and what people will really be surprised about is the alignment as it relates to law enforcement, as it relates to reduction in gun violence. We and gun policies. Most of the unions, most of those professional organizations don't want to see more guns, don't want to see more relaxed policies as it relates to guns. Because what we recognize is the more guns, the proliferation of guns that we see on our street, they fall into the hands of bad actors. And as it was stated earlier, the bullet, once that bullet leaves that chamber, it knows no bounds. It has no area code, no zip code. Some of the most tragic scenes I've ever been on has been when a innocent person was at a gas station just pumping gas and a bullet found them. Had nothing to do with the bad act at that moment. And so we generally are having conversations with the different organizations, and we meet with the Department of Justice and have these very strong conversations as it relates to it. And again, as I stated, we are in much more alignment than what people would think. You would think that they would be conservative thinking as it relates to it, but when we recognize the number of guns and the policies that are being made, we generally have that same alignment and push against those things. And I think when you talk about why people still trust in law enforcement and fire departments for those endorsements is because they trust those institutions to support them in their ideologies. And a lot of times it does work.
Nicholas, I'm a firm believer in examples, and so in the research, where do you see collaboration being done well between communities and law enforcement on this issue?
Between communities and law enforcement,
yep,
specifically. So I think when we're looking at some examples, I think Baltimore is trying to get into that with this ecosystem preventing violence when it comes to collaborating between CVI groups, between hospital groups, between law enforcement. And I think when we talk to CVI workers across the country, there's this importance placed on
you said CDI?
CVI.
So CVI, for the folks who don't know what that means.
Sorry, community violence intervention programs.
Got it.
I always get into the research mindset where acronyms
I got
get
you.
thrown
It's all
around.
good. I'll stop you. Don't worry about it.
Thanks, Roland. But I think when it comes to speaking to CVI workers across the country, there's this importance not just about the relationship between these workers and communities, but their relationship with law enforcement officers and law enforcement agencies. Having this symbiotic relationship where they can rely on law enforcement agencies in order to conduct their work in a safer and in a better fashion, and actually to prevent violence. Because when we think of gun policy, it's not just making communities safer, but it's also, like Rodney was saying before, making police officers' jobs safer. That if somebody's pulled over, there's not this fear in the back of their head, does this person have a gun? Do I need to worry about this?
So you said Baltimore. Where else?
So I think Baltimore is a good example of it. When we look at some other cities like New York, Chicago, I think there's more desire there in order to improve their CVI efforts by collaborating with law enforcement agencies.
Now, is part of the so where is part of the issue with these are not happening? Is there resistance and where's the resistance coming from, and then how do you break it down?
So I think when it comes to trying to build that relationship, it's balancing needing law enforcement's buy-in, but also considering these communities don't trust law enforcement. That if now I'm working in law enforcement, is the community going to trust me less? That maybe the ins I had is going to be ruined because now law enforcement's associated with this project, associated with our program. So I think it's considering how do we bring everyone to the table rather than just having this perception that law enforcement is looking over shoulders, that if I do anything wrong, I'm going to be reported, or that's going to be brought in here. So I think that's a big barrier to consider, is when we're trying to create these collaboration relationships, is what's that historic relationship between communities and law enforcement, or between communities and universities that are doing this research. Because I don't think individuals want to be research subjects. I think they want to work with universities in order to improve the conditions that they're living in.
And Rodney, police violence plays a part in that. I mean, the reality is, Chicago's had 2 patterns of practice investigation. You had the consent decree that was in Baltimore as well. And then, of course, we saw what happened in Memphis with Tyree Nichols, and these were black officers involved. And so what often happens is when those incidents happen, people go, see, that's why I can't trust them, and that makes your job harder to connect with communities.
Absolutely. So when it comes to the violence that we see initiated from policing, we recognize that there are a number of entities, a number of issues that come into play. And what we have to do, clearly what we saw in Memphis with Tyree Nichols was a level of training that needed to be addressed. And I think that I applaud Chief Davis for taking immediate action and going against what was traditionally a stand where police departments stood behind their officers, right or wrong, and play that thing out. She took immediate action. She saw something wrong, and she took immediate action. And that's what the community is desiring for us to do. But we have to be in a space where law enforcement agencies are more transparent in their actions. We have to be in a space where we aren't just standing behind our officers that continue to do wrong. We see it play out. And it's not just necessarily, I think that when it comes to violence, we have to take a deeper dive into seeing what it is. I like the part that you spoke about, that it's not a racial thing. I think that if you continue to target it as it being just racial, other entities just don't want to be a participant in it, and it doesn't give the attention, and it doesn't get the attention that's needed to address the true problem. And violence is a problem to all of us, be it black, white, or whatever the case.
But I think but this is the difficulty on this issue. Whether we're talking about violence in a community, or whether we're talking about police violence, is that depending upon individuals, circumstance, and the community, it is racial or it is class. In the case of what happened in Memphis, you have a significant black police force. That was a case of black-on-black violence, black police officers. That I said on my show, that's a function of blue. Then you have cops who are in police departments who say, man, I'm afraid to go undercover because I know how we get treated. And we've seen examples of that in New York City and some others. And that's a function of race and blue. And so then we talk about historically how communities have been constructed, how you've had divestment in those communities. A lot of that has to do with race. And so this, to me, is the dichotomy that we have to deal with, because if you remove race from a conversation, then you're removing a significant part of it. And so it's not always race, but race is also still prevalent.
Right. So, to be clear, I'm not taking race out of it by any means, because I know that it has a significant factor. But if you're only addressing the race, then we're not going to get anywhere with it. We have to address way more than just the race. as a component. You're absolutely right. So what we saw in Memphis were black men, and I don't want to. I think it's more than just the blue. It was more than just blue. And I think that we have to do a deeper dive into why we are seeing this violence. We have to do a deeper dive, and I don't think that I don't know of any institution is.
Well, the reason I'll say blue before I go to Angela, the reason I'll say blue is because how part of this issue is our laws are constructed to provide great protection to police, not just qualified immunity. And so if I know going in, I can do whatever the hell I really want to do, and the department's got my back, the union's got my back, the DA's likely not to charge, and then even if that's the case, how, to your point, how people trust police, then I can sort of operate with impunity. And so part of this, I mean, in Georgia, it wasn't until after the death of George Floyd, in Georgia's law was unbelievable, because you're based there, right?
Yes.
If a cop was indicted, that police officer got to sit in grand jury testimony, which is unheard of. Like, literally, the officer, normally grand jury proceedings are secret. That came out, even there were Republican lawmakers like, damn, we got to change this law. I mean, it was unheard of that a police officer could literally sit in a grand jury proceedings and listen to all of the evidence against them before they even got indicted. And that was a perfect example. That's something that is not provided to anybody. Then when you have also procedures where if there is a beating or a shooting or whatever, that officer has X number of days, sometimes 60 days, where they don't even have to talk to anybody. They can look at the body cam footage before they do interviews. I mean, that's the level of stuff you don't see anywhere else. That's what I mean by, in terms of this protection, if you will, when it comes to blue that our society has given, where the public goes, man, I don't stand a chance if you've gotten everything on your side. That's what I mean by the blue.
So, but it goes back to that other issue that you brought up about making sure that we had the right people in places. As a chief of police, I took action when I saw things of that nature. If I saw something that was wrong, I also brought in the community to take a look at those videos to see what I saw and have a conversation with them. Even before it would make the news, I brought them in and said, here we go. And if I saw an officer do something wrong, I fired that officer. Same thing, and I think that that's why it is so important that we have the right people in places, because you're absolutely right. Policies that are written, that were there before we got there, did benefit police officers. But I think having the right chiefs in place and that comes from the community, that have an understanding, we can take a different action, recognizing that a wrong has been done to our community by a member of our agency.
And then what you're dealing with, Angela, you're dealing with now contracts, because you have some folks who have been fired, then they get rehired, or they can get rehired in another jurisdiction. And so we're dealing with, and that's where trust comes in, because the public goes, well, what the hell? We got to fire them from here, and then they go to the next county and get hired there as well. But that's also changing because of activism, because people are mobilizing and organizing to say, no, let's get these laws changed to say, if you found guilty of beating someone in another jurisdiction, you can't reapply in another jurisdiction. And they're also trying to create a federal database to track that thing as well. But that only happened through organization.
That's 100%. As an organizer, I am very biased, but that is how a lot of things in this country that we've been able to move and see progress on is because people organize. I want to just stop and just talk about, because we were talking about race here, we're dealing with, when we think about gun violence, we're dealing with twin epidemics. We got white supremacy and we got gun violence. And so you are going to have communities that are disproportionately impacted. And absolutely right, it's not, the gun violence is kind of systemic, you can see it. But beyond that, the layers underneath, there's lack of housing, education, food, all kinds of things that need to be addressed. And this is why it's so important when we think about a all hands on deck system that is or an ecosystem, as I heard you speak about it. We're talking about not just the intervention that happens that helps, so there's not re-injury and there's not retaliation when we have violence happening in communities, but the preventative measures that help sever youth programs, other things like that. So when you think about how white supremacy has impacted communities of color and Black communities in particular, then you're gonna also see layered on it the violence and everything we're talking about when we talk about gun violence prevention. Couple stats here. Black folks are 12 times more likely than their white peers to be victims, to be shot and killed. Black kids, now I said this is a leading cause of death for all kids in our country. Black children, 17 times more likely. The data tells us clearly that there is a problem here. And so when we're approaching this system, we're approaching this problem, we're really looking at systemically, and we're really thinking about what can we be doing to help support community. And that means investment in community violence intervention programs, which is very necessary. Our Moms Demand Action chapters across this country and DC work hand in hand with community partners on the ground. Because while, you know, one of the things when I first came in is like, well, moms are so white, yes. We are growing, but we also have moms of all stripes. And it's very important, even those white moms are showing up and leveraging their power and resources to get attention on this issue. So we don't have to have the solutions for all the communities because communities know what they need. We need to make sure that we're working hand in hand and advocating and getting those resources into communities. So it is definitely what I say is an ecosystem, and it's all hands on deck, and everything that we can contribute is important.
Nicholas, are researchers grappling with and I hate to say the after effects of COVID because it's still with us, but it seems to me so many people act as if, all right, we're through 2020, 2021, some was in 2022, okay, back to normal, as if those three, we could just turn a switch on after those 3 years. And so when we look at folks say, man, this rise in crime, this rise in shootings after COVID, do we really understand how deeply communities were impacted with COVID?
I think what I'm seeing, at least when doing the research, just finishing my dissertation a couple months ago and like seeing and going through all literature there, is some work is starting to come out, but I think there's a divine research where some people treat COVID as this outlier. Let's not include it in our studies. Let's not really understand the effects because it's throw everything else off, which makes sense to some extent. It makes sense to understand what maybe was going on before, to understand how those historical factors affected the problem we're looking at, specifically gun violence. But when it comes to COVID and how that's affected communities, I think not enough work has really been done to look out, it disproportionately shifted and now is burdening the communities more. When we look at some studies have started to explore how gun violence has shifted geographically in communities. That during COVID we saw become even more concentrated within the most neglected and the most poverty-stricken neighborhoods. We're seeing even more shifts when it comes to more hate crimes, being now in Pride Month, thinking about the intersectionality of gun violence. It's not just this monolith of interpersonal violence. There's a lot more there that when it comes to LGBTQ plus individuals being at higher risk for experiencing gun violence in different ways that Black and brown individuals are in inner city communities. It's different when we look at interpersonal violence and how that might affect Black women specifically in their communities. So really trying to understand how COVID doesn't just affect where people are, but also affecting their mental health, affecting access to guns, or at least some of the things it feels like research is trying to understand now.
Well, I think especially the mental health aspect, because there's so many examples that I'm constantly having to remind people that it was a 100-year pandemic. That you just can't act like, well, it sort of happened and then we sort of moved on. No, I mean, it still has lasting impact for so many people, and we're seeing it play out. And when you're seeing things even today where folks are like, well, I'm just not quite sure what's going on. And like, well, you want to skip over that thing for the last 3 years? And then also one of the things that also jumps out that, and I'm curious if you know anyone who's focusing on this, the economic aspect of it. What I mean by that is, you have a lot of people, especially on the political side, they're like, man, all this money was in our pocket when Trump was president. Well, first of all, Democrats control the House. Then so it's not like he was putting money directly in your pockets. But I think we also overlooked the fact that we had a government that was literally investing directly in people. You had moratoriums on evictions. You had increases in unemployment insurance, direct payments for child care, all those different things. And in the last 15, 18 months, we've seen how those programs have been expiring. And now the economic pressures are returning back to people. Are you seeing anyone focus on that as well as it relates to gun violence, community violence, how the economic shift of dollars going directly to people now drying up?
So in terms of actual researchers, the names aren't going to come to my mind right now, but in terms of research, yeah, like looking at how insecurity is a risk factor of violence, and that, yes, gun policies can be put in place to address access to guns, but if we're not actually putting in place these social supports to address food insecurity, income insecurity, housing insecurity, those are real driving factors of violence. And COVID and all the different kinds of social support programs that are put in place during COVID that have started to dry up are now putting people at further risk, because instead of having that source of income, they don't have it anymore. What avenues are they going to turn to? And a lot of these communities don't have access to the services required, so usually illicit markets, drugs, stuff that puts you in more conditions to be around firearms or be around violence is now going to be your new reality again. So it's this 3-year support system that completely fell out. And what we've seen with violence research before that was already such a risk factor. Now, having experienced at least a taste of that and not having any more is just going to further perpetuate that risk again.
Absolutely. Questions? What we got? We got a microphone over here, microphone over here. Don't be scared. Down here? All right, step on down. What's your question?
I follow directions. You see I put my hands behind.
Yeah, I see. Hands behind your back. I see. Smart woman. Smart.
My name is Dr. Kim Coleman. I'm actually a program manager with the D.C. Department of Health. And Dr. Myerson, I hear you talking a lot about partnerships and collaboration between the community and the university. And what I hear or what I'm thinking about is that the approach that people don't understand is that to build that trust takes time. And so when I think about this, I think about it from a community-based participatory research perspective. Usually the first year is just building trust. How do we engage in that type of research, but still deal with the fact that we have a very immediate violence problem? And so there's, on the one hand, people are dying every day. On the other hand, it's going to take time to build those relationships, and especially to give up power from the researchers' standpoint.
Go ahead.
Yeah, it's really unfortunate how I think academia has built itself, that you're on these timelines to get your grant fulfilled, that you're on the timelines of what the NIH or these different funding agencies tell you need to be on, but it's actually give you the time to engage with the community. And there's not this need that's written into grants about needing to actually follow up with communities afterwards to tell them your results. That's just be kind of hidden behind a paywall of a journal, and it's not going to be communicated to anybody else. So I think for me, I want to really highlight some of the work I previously had done at Northwestern. Part of the Northwestern Juvenile Project, we had essentially worked with these individuals who were incarcerated in Cook County and worked with them for 25 years. And repeatedly, they said one of the most important things was a reason why they continued to engage in the project was we sent them birthday cards every year. So they're not just somebody that's contributing to our research, they're actually somebody who we know and care about them to some extent. That, yes, we can't, what's the best way of putting it? we can't change the way that we're approaching these. Sorry, wait. I had some line of thought and then it completely just like dissipate from my mind. But I think what I'm trying to say at the end of the day is that when it comes to doing this work, we can't forget about who's actually impacting. That, yeah, we can go get published and we can have that promote our own careers, but what is actually doing for the problem? So I think with the way the academia is set up, that's what needs to be really addressed in order to actually fulfill and build these partnerships with communities.
And I would just add very quickly that it's also back to ecosystem. It is not just the academic and the research components that we need. It's the advocates, it's the lawmakers, it's everybody, all hands on deck. So while you're talking about this timeline that people have immediate material needs, we need to make sure that we wrap around as a unit around them, a 360 wrap. So while we're collecting the data, get the advocates to help. Sometimes we have our chapters that do literally that, not just going to advocate for good policy, but we had a situation where there were a couple women coming out of intimate partner violence situations, and one of the women lost or had one of her sons killed, and she had to get a new place to live. And so we wrapped around, we got our volunteers to help support another group on the ground that was getting even things like furniture. So to your point, a birthday card, these material things in everyone's daily life is so necessary. So while we're getting those big things, we're passing laws, we're getting the research, we cannot forget that folks are still needing, and we need to wrap around and do what we can to support.
Question on this side? We have a question here?
Hands off. My name is Ethan Bartlett. I work with the Center for Gun Violence Solutions. So just a little bit about myself so my question gets across properly. I'm from New York, like 15 minutes north of the Bronx in the suburbs. I have personal ties to police violence. I have family friends that have been shot and killed by police when they have done nothing wrong. I urge you all to look up the name Kenneth Chamberlain Sr. after this event or during this event. I've been profiled by police myself. My father is a criminal and civil defense lawyer in White Plains, New York, and one of the very first serious conversations we ever had was about how I can't do the same things that my friends do because I'm not the same as them. I grew up in a predominantly black neighborhood but went to a predominantly white school. I thank Redliner for that. But my experiences are very different from those of my friends, and my experience is not unique to people that look like me. We've talked already about how this is not solely a race issue, this is not solely a socioeconomic status issue, but they both play a very important role in this that cannot be, we can't remove it from the conversation. So my question is, when we're talking about building relationships with people that have had these lived experiences, and have people close to them that have had these lived experiences, what does that look like in practice? How do you conceptualize approaching that, and what is actually being done, aside from saying we're building these relationships, what is being done in these relationship building processes?
Rodney?
Oh, absolutely. So the uniqueness of myself is I too, for you all, that the lights may be shimmering off me, but I'm a black man that grew up in the city of Atlanta as well. And so I've had many of those very same experiences. The unique, what my organization, what Noble does is try to get in the community and have these conversations to see how we could fix what we're seeing wrong. I think that we have to be of some form of action, be a part of, that's why I joined the police department. I wanted, and I worked in the communities that I grew up in. I saw, I wanted to, as a young officer, I remember seeing white officers put these black guys down on the hot pavement and leave them there. But I had now the authority to go in and say, lift these guys up. They've committed a crime, but we're not going to dehumanize them. We have to be a part and not be afraid to have these conversations, to say, how do we have to do it together. There's no one solution to this problem, and I think that's what people think a lot of times is this one solution. It's not. What we're seeing, we have to have every, you were talking about the academic part just a little while. I think that everyone has to be hands-on. Everyone has to be operational. We have to have these conversations and come up with a solution to the problems that we're seeing in our police department and in the communities that our police officers serve.
Question on the side.
Hi, my name is Nandita. I'm a recent graduate from Hopkins and a recent hire at the Center for Gun Violence Solutions. And I was just kind of reflecting on the conversations that we were having from the previous panel. That was incredible, and also this one. And it kind of ties back to what Dr. Myerson was talking about grants and research. And one thing about research is that our questions are often led by what the grants are asking us to do. And I was thinking about, we're in this space where it's a very interdisciplinary field. So my question to the panel is, how do we re-envision this to ensure that we're asking the questions that are raised by grassroots organizations, that are raised by advocacy efforts, to make sure that the questions we're asking are appropriate to the cause and are needed by the cause?
My response will be clearly different from the academics as it relates to
And that's why you're on the panel.
Because my experience has taught me that most of the issues that we encounter are rooted in the same place. I can assure you, my most violent community has an education problem. They have a health problem. They have a food desert. All of those, and every time I'm at these, I'm invited to a workshop. The other people that are responsible, there's no school principal in that meeting. There's nobody from the medical facility in that meeting. And then until we can get them to be actionable, and we can start holding other people accountable and stop throwing police officers at solving social ills who are ill-equipped to do so, we're not going to get to the problem. We have to.
But that's where public policy comes in, because in the wake of the death of George Floyd, when you had conversations about shifting resources, and remember I said earlier, it's the money conversation. People lost their damn minds. Oh no, we cannot shift money from police departments. When in San Francisco they said, let's send mental health folks to these cases. In Seattle, so what then it became, and that for people who don't understand, that what you're describing was actually what defund the police meant. The problem is those who, for political reasons, they're trying to defund the cops. What they were saying is, I think in Seattle was a perfect example. They had police officers writing parking tickets. They said, can we take that out of the police department's function? So certain departments then began to look at how they were deploying police. So again, when people, they were thinking that they were saying, well, let's just get rid of cops. Some people were, but the reality is most people, even were using that phrase, were saying you can't solve every problem with police. But that became a political weapon that was then used that actually stopped a lot of those efforts to shift the resources to what you're actually talking about.
Well, absolutely. And again, coming from the city of Atlanta, where that term was utilized, and I still live in the community that I grew up in. My zip code has never changed in the community that I live in. And so when I heard defund the police, I thought that it was a bad narrative, because in the communities where my mother, my grandmothers could not sit on the porch, that's not what they wanted to hear. They didn't want to hear defund.
But that's okay. All right. So let's leave it right there then. Okay. So what should have been the phrase?
The phrase should have been, we need more resources. We need to hold other people accountable.
Okay, but hold up. See right there. So this is part. I think this is part of the problem.
Not police resources.
H-
Not police
But
resources.
here's the deal, though. That's what it became.
Right.
So what happens is on a federal level, it was we're going to fund 100,000 police officers, and so so again, we were discussing narrative earlier. That was the problem. The problem is the people who were articulating defund the police, they literally were saying that means shift the money away from just funding it into different areas. And the public and the politicians said, absolutely not, because the response to shootings is more cops. And so the resistance to what you're describing came from the policymakers. They didn't want to do that, and this is where I say the health professionals have to come into play along with organizers and say, hey, you can't solve every problem by sending somebody with a badge and a gun. So Kojima Powell in St. Louis, there was a mental health situation. It was literally 9 seconds. No, it was 16 seconds from when the police arrived and the cop opened the door to the first first bullet fired. 16 seconds. That was a mental health issue. He's dead. And so that's part of the struggle, I think, that we're having.
Yeah, and oftentimes
About 3 minutes left. So
yes,
No,
we will.
30 seconds.
30
30
seconds. So I will
didn't
try
get
to make
a
it
chance to look
very
at my
quickly.
clock.
We can't have bumper sticker conversations. That's a bottom line.
There you go.
Even when we do things in our gun violence prevention space, and I'm talking to people that seem like they're not anywhere near my side of this issue, I got to pull it back to have that conversation. Ask the right question. When we're talking about this, what does a healthy, thriving community look like? That's right. What do we need in that community, and what is missing here, and how do we get it here is a conversation. But when we start talking in bumper stickers or on teams, then we lose, and that's what we've been doing for so long, so we need to do something different and something better.
Put your hands together for our panel, please.
Let's give another round of applause for Roland Martin and our entire expert panel. I'm going to ask you to stay in your seats and watch them take pictures, because our keynote speaker and our honoree is actually in the house. We would like to actually have the pictures be taken, and then we will immediately have Dr. Daryl Gaskin, who is the director of the Center for Health Disparities Solutions at Johns Hopkins University, introduce our keynote speaker. So pictures, please, and then we will move directly to the introduction of the keynote speaker.
Okay. Are we ready? Can I go ahead? Wait. Okay. Thank you, everyone, and thank you, Maya. Today we are fortunate to bestow the Hope Challenge Award in recognition of a leader who has gone above and beyond the call of duty to advance health equity. Today's award winner is a leader among leaders, someone who has been sounding the call for our nation to address gun violence prevention in the name of humanity before it became mainstream to do so. The Reverend Al Sharpton is the host of MSNBC's Politic Nation, a show that airs each Saturday and Sunday from 5 to 6 p.m. Eastern Standard Time, a radio host with three different shows, and the CEO of the National Action Networks, a civil rights organization with 111 chapters and 7 regional offices across the United States. The Reverend Al Sharpton and the National Action Network works tirelessly to bring the nation's attention to the disturbing trend of preventable police-involved gun violence in the United States. Reverend Al and the National Action Network were the first to organize a rally to protest the tragic death of 17-year-old Trayvon Martin, an innocent teenager who was shot by a neighborhood watch volunteer as he walked home with a bag of Skittles and iced tea. The National Action Network also called attention to the cases of Eric Gardner and Michael Brown, this helping to launch the Black Lives Matter movement. When 18-year-old Brown was fatally shot by a white police officer in Ferguson, Missouri, Reverend Sharpton organized a peaceful rally delivering the eulogy at the teen's funeral and reaffirmed his continuous call for police reform while urging calm during a tense climate. The National Action Network stands alongside families in their difficult quest for justice and police accountability. In the Gardner case, Reverend Sharpton and other civil rights groups put pressure on Governor Cuomo, which eventually led the appointment of a special prosecutor in New York City to investigate police killings of unarmed civilians. It set a precedent and a standard for the rest of the nation to emulate. In 2015, when a gunman murdered 9 African Americans during Bible study at the Emmanuel AME Church in Charleston, South Carolina, Reverend Sharpton traveled to Charleston immediately to speak at some of the victims' funerals. In Florida, he delivered the eulogy for 31-year-old Corey Jones, who was shot and killed by an off-duty officer who waited for assistance on Interstate 95 after his vehicle broke down. It was Reverend Sharpton who spearheaded the call for a special prosecutor after 17-year-old Laquan McDonald was shot 16 times in Chicago. At the National Action Network's 16th annual convention, former President Barack Obama said, "Change doesn't happen overnight, but it happens as long as we don't purposely give our power away." We've got to create a national network committed to taking action. We can call it the National Action Network. Please join me in congratulating the 2024 Hope Challenge Health Equity Award winner, Reverend Al Sharpton, for his outstanding service and stellar commitment for advancing health equity by advocating for gun violence prevention and for bringing this keynote remarks today.
Wait,
Well, good afternoon, or is it still morning? All right, one more minute. All right. Well, let me first thank thank y'all for having these panels and discussions, and I don't take for granted the work and continued service to this country that Maya has given. Stand up, give her a big hand. When we deal with the issue of gun violence, and I think that this should be a central issue in this presidential campaign, because I think that we've approached it sometimes from just a criminal justice perspective and not a health perspective. When you grow in a climate that you normalize gun violence, then you don't see gun violence as your way of choosing crime. You see it as a way of life. I grew up in a section of Brooklyn, New York called Brownsville, and it was considered at that time the worst ghetto in the country. Not that we were competing, but that's where we were. And gun violence was not unusual in that community. And the forces that make up your social setting usually sets your mentality. So I think that you have those on the political right that says we just need to stop it, lock everybody up. And that's one way to stop it. We have people on the left saying, well, let everybody free, let's go, let's defund. And that's another way to stop it. And I think that what we've got to study is somewhere in the middle that doesn't deal with building a let's lock everybody up mentality or let everybody go mentality. We need to deal with trying to resolve and heal the problem in the middle. Now, if young people of any community grow up with a diet of gun violence on television and online, that adds to it. I mean, when I was growing up, people would ask why were some of us violent, and the shows we watch, Have Gun Will Travel, Gun Smoke. You look like you're old as me, you start nodding your head. Murder, She Wrote. I mean, so if you grow up and this is your entertainment, then you don't see it as criminal. Or if your status in your community is being a member of a gang, because there's no other kind of social interaction that is provided for you. We didn't have places that we could become members of or something that would give us some other way to enter life. So gang banging became our social setting. And growing up in single-parent homes, our father image became the gang leader. And I think that a real look at the social setup of communities and dealing with this as a issue of dealing with mental health can really address the issue of gun violence on a mass level. And the reason I started by saying this ought to be in the elections of this year is those that are running for elective office from president down ought to be addressing what will they put into our legal as well as our social order that would address the issues of the mental health of why we have gun violence in the country. And I might add, this supersedes demographics, because the same problems are in poor white communities, poor Latino communities, poor black communities. Because where people have less options in their environment, they become a creature of the environment, and part of that is a dog-eat-dog, violent kind of lifestyle that we don't see as criminal. So no baby is born saying that I don't choose to be a professor, I choose to be a criminal. Everybody becomes what they become based on the environment and based on what aspirations are implanted in them. I started preaching when I was a young boy, in part because my mother brought me to church since I was a young boy. If I had not grown up in the church, I probably would have never wanted to be a preacher. But she brought me to church. I was 2 or 3 years old. They baptized me. I didn't know it. I thought I was going to swimming class. I didn't know what it was. But the biggest thing in my head, the biggest thing I could see was the bishop. So I wanted to be that. But the guys that lived in the same tenement that I didn't go to church. Biggest thing they saw was, like I said, the gangbangers. So they wanted to be that. As I turned a certain age, the big guys out there were civil rights guys. I liked that. So I emulated Jesse Jackson, John Lewis, who were like a generation ahead of me. So the fact that others went differently was one, the example. But then you develop a mentality around that. And some people, I had a relative, a cousin, that had temper problems. So because he never dealt with temper issues, he would immediately deal with violence because that was his way of dealing with his temper. Because no one ever trained him or taught him that you need to deal with that problem. So I really don't know that a lot of young people understand that it was absolutely a taboo to even talk about dealing with mental health situations in our community, because people would say, "What do you think, I'm crazy?" No, I think all of us need help. And I think all of us need help in certain areas. Part of discrimination is to act like what others do that helps them is not about us. And if our authenticity is defined by our limitations, then we are self-segregating ourselves. So I think mental health must be put in the proper perspective of something, and I'm again challenging our political, not only office holders, but those that seek political office, that we've got to normalize dealing with mental health. What should be unacceptable is to act like mental health is something that should be for only people that, quote, act out. Secondly, locking up our problems doesn't solve the problem. To incarcerate the problem doesn't solve the problem. You only delay the problem. So if somebody shoots somebody or hurts somebody and you give them 10 years, that just means in 10 years they coming out and doing the same thing. Healing is not delaying dealing and addressing the problem. Healing is dealing with the problem, addressing the problem, and seeing how we can get the problem turned around. And if we are to deal with the rise of gun violence in this country, we need to deal with that. The thought that we are now normalizing, it is almost like not even a big deal when we see mass shootings anymore. That's sick. When we say, oh yeah, and there was another shooting in Philadelphia last night, 3 people dead, but let me tell you who won the game last night. There's something crazy about that. That we have now become, I can't tell you how many Stop the Violence rallies I went and we said this is going to be the last time. And we didn't even get through the end of the week without another mass killing. Because again, we're dealing with mental health issues. What makes somebody get up in the morning and decide they're going to go shoot up a school? That's not normal thinking. And yeah, we need to deal with guns. Yes, we need to deal with automatic weapons. Yes, there's no reason for people to have AR-15s. But it's also how do we deal with why would you have the mentality to go and shoot up little children that haven't done anything to anybody, just got started. Something mentally we won't deal with. And they're not talking about that. We're arguing about NRA, the size of guns we should sell, rather than the mentality that makes normalizing this something that we just say, wow, did you hear they shot up 5 people in Baltimore last night? Ain't that something? And go on with your dinner. That's how crazy we all have become. And I think that if there are those of us that are really committed to this gun violence problem, and that is why what you're doing with Hope Challenge is so important, we've got to have the courage to dig a little deeper, to deal with solving the problem, not just dealing with is expressed because of the problems we haven't solved. We've got to dig a little deeper, and that's not going to get you the headlines. And it's not going to be something that everyone is going to be attracted to. But the sincere warriors of trying to deal with violence, it knows that it's going to be multifaceted, but you can't eliminate the core problem in this country, and that is that we are not dealing with mental health and seeing violence related to that. The criminal justice system is not just the only option, and in fact, it is not even as important in my judgment than dealing with the mental health issue. People that want to solve their differences and their problems or deal with their own, as we call them, demons, and what they've not been able to deal with in life, they cannot solve it and without some help and some guidance from those that are trained to do it. So my hope is that after we have gone through the panels today and after you continue to work, is that you see it as just as much as activism and frontline importance to deal with the issue of mental health and putting this social discussion in terms of public social policy over in the area of making mental health a real issue in the body politic in this country. One of the things that I've tried to do, not only with National Action Network, the civil rights organization I had, but with my media, my TV and radio shows, is to try to not deal with the sensationalism, but to deal with why and what. And the audience I get, and I get a big audience when Maya's on. We can't get her every week, but she attracts a bigger audience for me. And the audience responds to that in the emails and texts we get because people, I'll say this in closing, people are almost afraid to come out and say things. What I mean by that, I can't tell you the amount of text messages I get saying, Reverend Al, my son has a problem and I just don't know what to do with it and I was scared to talk about it till you brought it up. Why are you being ashamed of something that we could deal with? And people, I speak at churches, people will whisper to me about a mental problem. That, in my opinion, must be confronted and dealt with in this country. People should not be ashamed to ask for help. People should be ashamed not to ask for help. We ought to make people comfortable. We ought to have comfort zones for people to say, I want to bring my cousin here. I want to deal with some of the stuff myself. We must become introspective and ask ourselves, why are we not dealing with this? Why are we not looking into this? And why are we throwing it to everybody else to deal with it, as I said, to lock it up rather than lift it up? We all have issues that are unresolved. And the more we resolve them, the better we become as a nation and as a community. So I wanted to be here. I'm very happy and honored for Maya to ask me, but I'm even more honored to work Hope Challenge is challenging us to do, is let us stop copping out and acting like this is a court and police issue alone. Nobody has fought policing, bad policing, more than I have, but that is not the only issue. There's something that we've got to get into the heads of the people in our country, and those that need help, we need to help them. Otherwise, there's something wrong with us. Thank you very much.
Wow. I take those words that he gave to heart. I think that they were well developed in the context of what we're facing in this country. And if we aren't, of course, careful, we'll end up talking about policies and systems and ideologies without dealing with the fact that individuals are absolutely also dealing with challenges in terms of the paradigm of how they're coping with all of the stresses of our society. And the fact of the matter is that many of us are actually facing these challenges. So I want to say thank you to Reverend Sharpton for inspiring us today and demonstrating what it looks like to stand for public health by advocating for gun violence prevention. We are in the midst of a multi-generational struggle, and it will be this movement that helps determine whether our nation continues to allow policies and practices that result in preventable gun deaths and disability, or whether we will transform our policies and practices and perceptions, I might add, to center equity and the value of all human beings by ending preventable death and disability due to gun violence. Listening to the remarks today was a privilege, and none of us will ever forget it. We deeply appreciate Reverend Sharpton's leadership and look forward to many more years of collaboration and accomplishments together on this vital issue. I want to thank the entire Hope Challenge team who made today's events possible. Can you give a round of applause to all of our teammates who have done an excellent job in putting together 4 Hope Challenge issues? And for those of you that don't know, Hope Challenge means, hope means health opportunities for policy equity. We believe that there are preventable health issues that can be prevented with public policy, and this is one of them. And so I want you to remember that you are invited to join us upstairs on the 8th floor for a networking luncheon immediately following today's event. We also invite you to use our QR code. I don't see it up there. There it is. Displayed on the screen to take a survey asking you about today's event. We encourage you to complete it so that we can use your feedback to enhance our future events. We hope to see you upstairs for lunch. Thank you for your time, and we wish you safe travels to your next destination. Take care.
And just before you leave, I'm just calling an audible. Hope Challenge is just sort of birthed out of a conversation that I had with Dr. Rockamore Cummings about trying to get things in which we know to do about pressing health disparity problems, that we actually bring them to the attention of policymakers and actually get to do them. And so we had probably about maybe a 15-minute, 30-minute conversation, and then she took that idea and created this venue in which we all are enjoying today. We did one on HIV/AIDS. We did another on cardiovascular disease. We did one on maternal and child health, and this one on gun violence. We brought in partners, and largely through her efforts, the Congressional Hispanic Institute, the Congressional Black Caucus Foundation, as well as NMAC, and then also some of the media personalities who have brought these issues forward. And so I just think it's fitting. We've given these Hope Equity awards to a lot of different people who've come through here. But this effort would not have happened if it were not for her efforts. So I would like to present this award to you, this Hope Challenge Award, because you are really a tour de force, and I just want to let you know that we appreciate your efforts. She's a visiting scholar here at Johns Hopkins. We don't have the benefit of having her expertise in our constellation, but she has certainly brightened up my center, the university, by her brilliance and her excellence. And again, let's just give her a wonderful hand. Thank you very much. I really appreciate you.
Let's go eat.
Okay.